been quite a morning. We've got a real special guest here. And so imagine leading a ship through uncharted waters, steering it with unwavering vision and an unyielding commitment to the crew's well being. That's exactly what Kelly Kennedy Garcia has done for the Department of Health and Human Services. Last year at this summit, I heard her speak for the first time, and I was so impressed. She was appointed as the inaugural director of this agency in November 2019. Kelly transformed the landscape for social services in Iowa, navigating the state through a pandemic while restructuring the agency into a unified force for health and human services. We used to get a lot of complaints about this agency, but Governor Reynolds told me now she gets more compliments than complaints. So that's a real tribute to Kelly. With over 2 decades of experience in program evaluation and policy development, Kelly's journey from Texas to Iowa has been marked by an extraordinary ability to blend strategic foresight with human-centered care. Please join me in welcoming Kelly Garcia.
Good afternoon. I am delighted to be here with you all today. I'm Kelly Garcia. I am the inaugural director of the Iowa Department of Health and Human Services. And today I'm hopeful to give you a sense of what we're working on in the agency. But before we start, I want to talk to you a bit about my own journey. Thinking about food and thinking about food is medicine. So I grew up in rural Florida. You're wondering how I got to Iowa. I got here as soon as I could. So I grew up in rural Florida, and my mom had a really deep commitment to fresh food. It typically was stopping at the local fishmonger, who was truly on the side of the road on the way home. And I was always the kid that had an alfalfa sprout sandwich instead of McDonald's on a field trip. And I think our society has changed a lot. We're now in kind of a fast food nation that's born out of, the pace of today's life. But I think we have a deep commitment to change the way we think about that. Fast forward to my 20s and my early 30s, I was struggling with a really significant number of very deep health concerns. And this is where it takes a weird turn, but I decided to become vegan. Not so much because of a hatred of meat. In fact, I'm an Iowan with a meat share now, as everyone good Iowan should have. I have a deep commitment to a farmer in Knoxville. But I very much struggled, and I wanted to really think about a very conscious way to connect me to what I was eating. And so becoming a vegan helped me do that. And I now have 2 beautiful children through that recommitment to my own health because of that discipline. So there are so many reasons why I'm called to this HHS work. If we were in a different forum, I would tell you all the reasons connected to child welfare. But what I do know is that we have to think about the call to action of why we're here today, and that it's more than just restructuring another cash balance benefit card. It is absolutely deeper than a home delivered meals program, although those significant foundational supports are important too. But we have to think about our HHS system centered around the individuals that we serve and go deeper with data to understand how we build pathways for true economic mobility and health resilience. So a year into this agency, focused on lifespan services with all the social, food, and medical supports, truly living in one division. In fact, our division director, who might wave right now, is in the back of the room. Erin Drennan comes to us with a wealth of experience and now has the ability to truly build out a one-stop shop to help Iowans. And she is working on just that. We know that on any given day, we serve more than 1/3 of Iowans, which is a staggering number. And we also know that 1 in 9 Iowans face food insecurity. And Michelle really queued this up very nicely because I'm going to talk about exactly what that means in our landscape and where we're headed for our deeper work. We know that that number is more significant for children. And obviously, we are an agency that focuses tremendous resource and effort on our youngest Iowans. But food insecurity at times is a symptom of a much more complex issue. In our new unified HHS structure, we've compiled a dashboard on each of our county's health metrics, and we have a statewide model as well. And Sarah Ekstrand is in the back of the room. I've brought you these dashboards today. So on the way out, Sarah will have them for you, and you can take a copy if you so choose. If you'd like to dig deeper into these metrics, every single county in Iowa, all 99 of them, and the state profile is on our agency website. I visited with each senator on this during this year's confirmation visit. And I want to talk to you a little bit about what these metrics show. They're social, economic, and environmental factors. There's also life expectancy rates and access to healthcare, all metrics of the bearings of a thriving state or a population health metric data set that tells us that there we have areas to focus on. As we look at this picture of Iowa, I see that we have clear room for improvement in these metrics statewide. And I want to orient you to our approach around well-being and access to nutritious food. First, our agency is focused on a multidisciplinary and multi-pronged way to approach this issue. And that sounds phenomenally bureaucratic, but I assure you, it is a very complex issue. It's not one that has one single answer. All of this has to be addressed to ensure a long-term viable solution. And it's supplemental, as I mentioned in the beginning, to the traditional benefits that you know about legacy DHS. So let's talk about that state health report card. I'm going to give you a few facts here. There are some facts and figures that we absolutely need to focus on, and let's start with cancer rates. Iowa has the second highest incident for cancer in the U.S., right behind Kentucky. Obesity increases the risk of cancer significantly. It also impacts mental health, maternal mortality and morbidity, and the list goes on and on. We know that eating healthy is protective and preventative, and it is preventative of all types of bad outcomes, and that includes cancer. And I'm going to share a super interesting fact that we had a really robust dialogue around very recently as we are digging in deeper to our metrics. In 2022, population data showed that 22 states had an adult obesity prevalence of 30 at or above 35%. That was compared to 19 in 2021, and that's according to the CDC. Just a decade ago, no state had an adult obesity prevalence at or above 35% in a decade. In a decade, it changed that much. Let that sink in. More than 1/3 of Iowa adults are obese, and in the more recent State of Childhood Obesity Report, Iowa ranked 18th in the nation for childhood obesity. 18% of children 10 to 17 are obese, and we're among the top 10 states for high schoolers in an obese category. And 36% of adults in Iowa are obese. We rank 11 out of 51. It's incredibly concerning. And at the same time, as Michelle indicated earlier, right, we know that 1 in 6 youth are experiencing obesity. That same metric shows up on the food insecurity side. And that's because our traditional models incent these high-filled, high-carb, easy options that fill the tummy but are not nutritionally dense. Historically, and there's been a significant shift with our food bank partners, our food banks were full of donations that were the same. And this is significantly shifted, especially in our state. So we strive in our system to promote agency, and we believe that individuals make choices for themselves. But our system has to support that. And I'm a person, I love a vegetable, but I love a treat, and everyone gets to have that. And I love a Chick-fil-A on occasion. But we have to shift our major systems and really evaluate what we're promoting within them. And we have to be unapologetically dedicated to measuring outcomes instead of layering on additional new programs. So with all of this in mind, what is our agency doing to address these very significant health concerns, as well as the significant prevalence of food insecurity that's being discussed today? Our list is significantly longer than what I can share in the time that I have with you, but I'm going to highlight a few. And I'm going to start with our traditional programs because they are the cornerstone of our work in the agency through our eligibility function. So far in 2024, Through the Supplemental Nutrition Assistance Program, SNAP, we have served nearly 132,000 households, and they receive an average benefit of $335. We continue to provide SNAP education, and we do that work along with the Healthiest State Initiative and 5210, and that's all focused around those healthy option discussions, especially that we have with our youngest Iowans. But we're also getting really creative about how we answer this call to action. And when we think about that deeper data point, and based off of these metrics, our SNAP participation is stagnant, if not declining in some areas, and we see that in other programs as well. So what's that telling us? It's telling us a very different story than the call to action and outpaced need that we're hearing from our food bank partners. So based off this program participation, we believe that many families are not earning enough to provide for their family, but they earn too much for the traditional programs that we run in our agency, like our SNAP program or emergency food assistance, both of which have very clear financial eligibility requirements, which means that working families are seeking help at food pantries for the first time ever, or for the first time in many, many years. Families may also be widely disconnected from a front door eligibility process because our system can be confusing. And we are thinking long and hard about how we break free from the drab DHS office model into a brightly lit pathway that allows us to engage our partners who are on the front lines to assist individuals in coming into those traditional benefit programs. So how can we help support families to truly thrive? And what do these numbers tell us about the health of our safety net system? For the last year, we've gathered business leaders, healthcare professionals, other state agencies, nonprofit leaders, and university partners to really dig deep into what incents true economic mobility. A component of this is an analysis of our cliffs in benefit programs, but it's much deeper than that. Our focus today is on the access to nutritious food as one component. Access to childcare falls in that category as well, and the list goes on and on. We can't have that conversation without noting that the cost of food has increased 25% from 2019 to 2023, and that is staggering for all families. Despite the fact that families are working, they're doing their best, they're not able to make ends meet. They may be receiving benefits, then they start earning a little bit more on a program and that eligibility requirement kicks in. They have a setback and they're off benefits, and they have another setback and they're back on benefits. Or they hold back from taking that next level advancement because they know that the cliff is coming if they do. The focus on economic mobility is concentrated on deeply understanding that game of chutes and ladders. And that's what it is. It's a merry-go-round of dependency when our whole goal, and I know everyone in this room strives to ensure that we build pathways. We're all pathway builders in this work, and that we believe that individuals have agency and self-sufficiency. 25% of Iowa's households who work, earn, and pay taxes cannot meet their basic needs, combined with 12% of Iowans, which was mentioned a bit earlier, who are at or below that federal poverty limit. The level shows that 37% of Iowa's households, which is about 450,000 families, struggle to achieve true financial stability. So moving Iowa's families beyond financial stability and digging into these different kinds of resources, social capital and belonging, which is a deeper part of work that we're doing in our agency, it removes that chaotic structure that has long existed for decades and instead inserts true pathways to thrive. Through this Fostering Economic Mobility project, our department, led by Erin Drennan in this particular area of our agency, is creating a truly integrated approach. We're assessing and evaluating in a very, very deep way all of the assistance programs we have in the state, truly, and adding in some deeper analysis around the Medicaid program and housing. And we intend to bring options, dare I say solutions, this winter to legislators to reach those families I described. Our agency is also embarking on a very significant shift in the way we think about our work. Through our governor's vision, and she mentioned this during the condition of the state, Thrive Iowa will create a true network of navigators that connects Iowans with immediate support from community organizations. So when you think about our work, we have this whole host of those cornerstone foundational benefits that exist at the state level. But there's also a rich fabric of incredible community support through faith-based organizations, nonprofits, and other partners that exist at a local level that take a real heroic effort to connect people to today. Our goal here is to to include navigators who help individuals access these services, but to also build a platform, an actual, true, closed-loop referral network across the state that connects this rich fabric of resources. And I'll tell you, and I'm new to Iowa, all things considered here, right? And so I will tell you, I have never seen a more rich array of incredible assets at a community level. This state is truly remarkable in its ability to solve for problems, in its resilience, and in this incredible dedication to helping neighbors. And so I believe this solution helps us take that next step forward, which today is largely disconnected, or because Kelly happens to know another local person and can create that network, but it's dependent on Kelly and that other person. And if I go, there's not a system in place to connect those resources. This solution changes that model and creates an actual system. This launch will happen very shortly, and we're going to pilot it because it's a true demonstration. We're stepping into new territory as Iowans here, and we're going to be learning along the way. But the goal is to move this forward statewide, serving anyone and everyone who comes into a door needing help. Last, but certainly not least, and again, this is just key highlights, so it's not an exhaustive list of what we're working on. Let's talk about food pantries. Michelle queued this up quite nicely. I've had the opportunity over the last 2 weeks to be in 2 food pantries, both remarkable in their own unique ways. And then earlier in the early springtime with Michelle at a local school pantry that she referenced her ambitious goal of ensuring that all schools have access to these remarkable ways of serving communities. That particular pantry here in the Des Moines metro area was absolutely bustling when I visited. It was held after school and into the evening. Parents were there to pick up items. They were also picking up their kiddos. And it was obviously run with the foundation of our food bank partners, but really staffed with a rich fabric of volunteers that make this model work. It was incredible to see because there was really clear rapport amongst the families and the individuals who were working there. And it was absolutely everything that you would expect a welcoming site to be. Laying eyes on families, talking to them about other needs, providing culturally competent and relevant food. There were other small children, not school age quite yet, there alongside moms and dads. Again, all of the community aspects you expect to see. And just last week, late in the week, I was in Carroll with one of our most stellar providers, a true gem of a provider, and they have a food pantry on site as well. We talked about their provider network and their volunteer network. They have set up a true one-stop shop mechanism in Carroll, and they tailor around what works for them, but they also wrap around a whole host of other services along the way. They also happen to be a community action agency, so they're one of our very best partners. And that is exactly the type of model that we're looking for. A true brightly lit one-stop shop, no wrong door, choose your logo here, around what we envision in a true unified HHS structure, a space that's trusted, is where I see finding solutions for Iowans to truly access nutritious food on an ongoing basis. Our agency is leaning into this incredibly deeply, leveraging the vast array of funding sources that we have at our discretion, and always having conversations around new and innovative ways to stretch those goals, which we intend to do again this session, and creating additional access points so that families who present in need receive all of the services at one point point in time so we can really stop that game of chutes and ladders. I've covered a lot in a short amount of time, but I've outlined data, and I do want you to look at those metric sheets. They're quite fascinating. I've talked about the approach of our agency, a philosophical shift in the way we're thinking about this work, and what I want you to take away from today is that HHS and its partners are deeply committed to solving this issue. And I absolutely know, their shift in our agency is to not do this in isolation, to not think about the way we've always done it, but instead to invite a whole host of partners to the table, of which each one of you are, so that we can solve this together. And I very much know we can. So thank you so much.